Welcome back to 20 Minutes of Science so that you don't need a PhD. Emily, thank you so much for joining us. And prior to hitting the record button, we were talking a little bit about your interest in the brain body connection within research and within medicine. And I think often among the general public, we don't really understand what leads people into these like niche areas of science. So could you tell us a little bit about your path and how you got interested in this?
Well, thanks for having me, Nate. I guess for me, this path, it kind of started from more of a personal connection. So when I was in high school, I was diagnosed with an autoimmune disease, and that actually caused a lot of different symptoms within the body. And part of that was kind of mental health symptoms that manifested as a result of the inflammation. But in trying to manage these symptoms, I realized that certain things that I was eating or certain compositions in my diet, if I changed those up, it would actually help to make me feel better and more energetic and would actually help reduce my physical symptoms as well. So my inflammation and joint pain and things like that. So I just found that a very interesting, I guess, N of one case study. And that kind of led me down the path of looking into, is there something that there is research to support? And in doing so, I landed upon my PI, her research, and she was looking specifically at the relationship between metabolic health and psychiatric illness. And so that's what led me to her, and that's where I've been for the past, gosh, 5 years now. So,
Time flies when you're studying what
yes,
you
for
love.
sure.
And I love that. You took a trial and basically used it as a catalyst to enter a field where your insights are helping a lot of people in the way that research can lead to enhancements within medical practice. Prior to getting into the facts, because I want to know a lot more about this, I'd love to first go into some myths here
Okay,
because
yeah.
metabolic health, we talk a lot about this. I think most people think, like obesity and things like that. And then, of course, mental health is it's among the general public. It's like a separate area of research in
hmm
medicine. But you work at the intersection of these. What are some things that most of us just don't understand or that we maybe do understand, but in the wrong way?
Yeah, I think that's a really important question. I think one of the main things that I want to address right off the bat is that people are not their illness, and it's important to talk about illnesses in the way that someone has an illness, they are not, schizophrenic, they're not psychotic, they have psychosis or they have schizophrenia. And that's really important distinction to make because it kind of colors how we approach these conversations within the community, and it really does impact like how patients view themselves as well, and that can impact their trajectory of their treatment and their illness course. Particularly with respect to symptoms and the brain body connection, I want to really dispel the myth that people with severe mental illness, so that encompasses like schizophrenia, spectrum disorders, major depressive disorder, and bipolar disorder, that they're lazy or that they aren't doing what they should to take care of themselves. I want to kind of emphasize that often the medications that they're on, they will develop metabolic problems that then impacts their ability to just carry out day-to-day functioning. And so what a lot of people don't know is that metabolic uh, metabolic illness such as obesity and insulin resistance, it can actually affect cognition. It can affect your ability to kind of engage normally within the community. And so that's something that isn't always really realized or talked about, that these metabolic impacts can directly impact your ability, the ability of your brain to function. So that's something that I really want to get out there and make sure people know that these are truly connected. And then one other thing I kind of want to dispel is that people think that if you're on like a psychiatric medication, that, oh, your symptoms are magically taken care of, you should be fine, you should be able to function. And if you don't, then that's on you, that's your fault. You need to try harder. Actually, in the specific case of schizophrenia spectrum disorders, the medications we have are pretty good at treating psychosis and positive symptoms, which are things like hallucinations and delusions, but they actually don't really have much of an effect on what we call negative symptoms, which are things related to motivation, things related to pleasure and low mood, fatigue, things like this. So it can be very difficult for individuals, even if their psychosis is treated, to again function normally day to day. And so that's something else I want to kind of dispel as a myth. that, medication solves all. It doesn't. There's still a lot that people need to go through and manage.
So much to unpack there. And I think you
Yes.
hit the nail on the head in regard to basically the view of the public on these things.
Hmm.
I think these are truly these points that you went through. These are things that people don't necessarily remain aware of whenever they might be passively or actively judging someone and their surroundings. And forgive me if I'm asking a question that has no answer. I have to ask it because I know that anyone listening has this question. With what you've described about some of these medications having
Hmm.
their own effects. So, we have the symptoms from the disorder itself, and then we might have secondary symptoms from the medication. Is there a solution for this? You know what I mean? Like, if someone is in a position where they might need or greatly benefit from a medication, yet it's going to have these downstream metabolic effects that might decrease their quality of life. What are we typically telling these people in clinical environments? Do you have insight on
Well, as you said, there might not be a one size fits all. There might not be a true answer for this, but it is typically quite a kind of a risk benefit trade-off that happens. And so one thing that we've noticed in the field is that some of the most efficacious antipsychotics, and I'll focus on antipsychotics because that is my area of expertise, but some of the most efficacious ones also tend to have the highest risk for metabolic side effects.
it?
There is potentially something underlying in terms of mechanisms that these medications are affecting both of these pathways. And it's hard to tease those out. So when it comes to choosing a medication to put a person on initially, it's really important to kind of have a discussion with them about the risks and benefits of the different kinds of medications that we have and the different, I guess, potencies of the antipsychotics.
I see.
It's still not perfect, but the field is trying to move toward engaging patients actively in their antipsychotic choice and things like that. But in general, there's no real way of getting away from these metabolic side effects because antipsychotics do remain the gold standard treatment for these conditions. There are some newer medications that are being developed that supposedly have less of a metabolic side effect risk, but that does come with lower efficacy. So they have been shown that these newer medications, they might be beneficial in, for example, bipolar disorder with psychotic features or major depressive disorder with psychosis, but for more of the pure schizophrenia spectrum disorders, they're not as effective. So we're still relying on these really tough medications for patients to take. And I think ultimately it comes down to having that discussion with them right off the bat and kind of putting in place precautions in terms of lifestyle as well as adjunctive medication. So it's now common practice to co-prescribe metformin, which is an anti-diabetic medication, to individuals either when they start antipsychotics or early on in their journey with antipsychotics to kind of try to help mitigate those metabolic risks. But yeah, there is no pure solution yet. I think we need a better mechanistic understanding to get there, but we're working on it. That's what we're trying to do.
And that's what I was going to say. You're out there finding it for us. And I think that's amazing. And with that, I'd love to ask a little bit more about your personal path
Mhm.
because you just finished a PhD, which for anyone in the more general audience that maybe doesn't understand the rigor of that, that is a long time studying a very specific question. So I'd love to hear a little bit more about your question that you pursued an answer to as a PhD student. And secondly, I know you were talking about how you want to bridge your research understanding to ultimately work as a physician scientist,
Mhm.
perhaps within psychiatry. And I'd love to hear about maybe what pieces from your research may have sparked this interest to carry that into.
Yeah, great question. So for my specific research question, I was looking at the relationship between antipsychotics and glucose metabolism, and the central mechanism underlying my research was looking at brain insulin signaling. So insulin is a hormone that does control glucose uptake into tissues, and it is important after a meal to help your cells get the energy that it needs. However, there is pre-existing research that shows that this signaling pathway could be disrupted in metabolic disease, but then also in psychiatric illness. And specifically, we have seen that there could be something happening in the brain, because typically when people think of insulin, they think of organs like the liver, they think of muscles, and they think of fat. But there are actually insulin receptors throughout the brain, including in important regions like the hypothalamus, which is important for homeostasis, the hippocampus, which is important for memory, the striatum, which is involved in motivation and pleasure-seeking behaviors, and then also in the cerebral cortex, which is important for kind of executive functioning and decision-making. So there is preliminary research that suggests there could be something going on there where the insulin signaling isn't working properly in the brain.
Wow.
And there are pathways connecting the brain to the rest of the body. So specifically, there's something called the brain-liver axis, and it's thought that it is able to, or it has been shown actually, that it does directly control glucose production by the liver, which we call in the field endogenous glucose production. So actually the kidneys produce a little bit. So endogenous glucose production encompasses both liver and kidney glucose, but it's predominantly the liver. There is some research suggesting that brain insulin is regulating that, and then if that's disrupted, that could contribute to kind of dysregulated glucose throughout the body, not just in the brain.
That's fascinating. So many questions. I guess I'll start with one and maybe
Yeah,
limit
go
myself
for
to
it.
one because I have many areas of this I want to ask you about. What are the major consequences of this? Like we have this disruption you've described, which is rooted in the brain, which is
Mm-hmm.
incredibly interesting. What might this manifest as in a patient's life?
Yeah, so central insulin resistance, it's still, I want to preface, it is still kind of a working hypothesis. It hasn't been definitively proven yet, but it is something that we are continuing to explore as the evidence does seem to keep accumulating a bit. But it is thought that if this pathway is truly doing what we think it's doing and is truly dysregulated in the way that we think it is, ultimately that could contribute to hyperglycemia, which is persistently elevated blood glucose or blood sugars, and that ultimately can lead to diabetes down the road, specifically type 2
I see.
diabetes. And that's a very serious metabolic condition that takes a lot of management and can be very difficult for people just in the general population to handle. But then if you also add on having psychiatric illness, that can make it even more difficult to manage. So that is one thing that we notice. We also know in general that individuals with schizophrenia spectrum disorders, both on and off antipsychotics, so there's a pre-existing risk for metabolic disease and cardiovascular disease, but then antipsychotics kind of exacerbate that. And cardiovascular disease in this population actually contributes to roughly a 15 to 20-year decrease in lifespan compared to the general
Really?
population. So in general, it's a pretty serious condition affecting this population, and it's really impacting their health in major ways. So
Wow.
the cardiovascular piece, it's also a bit unclear what's happening there. A lot of things in the field, it's more reactionary, and
I see.
that's just kind of a nature of the fact of how complicated some of these mechanisms are.
Makes
Sometimes not ethical to do certain mechanistic studies in humans. So we can
I
do
see.
them in rodents, and we can show a more clear relationship between, for example, brain insulin and diabetes in rodents, but it's more difficult to prove, let's say, in humans. So we're trying our best to make connections, but still there's a lot of questions remaining in the field.
Yeah, very interesting. In fact, I would venture as far as to say for any neuroscientists who are listening in, it sounds like an incredibly intriguing area to enter as a researcher because so much
Mm-hmm.
unanswered. I could see so many avenues that could be
Yeah,
pursued.
for
I
sure.
think you already had answered the question of what led you there, and you have a very powerful story. But second to this, it's incredibly interesting, this brain body connection. I'd love to get further into the weeds of the science, potential mechanistic hypotheses you might have, and perhaps we'll have to have a part two that's more focused
Yeah,
mechanistically.
happy to come back if you'll have me.
Awesome. Awesome. But I'd love to zoom back out, I guess, for the
Mm-hmm.
next few questions, kind of for, what does this mean big picture for society? As a first, I'd love to know, you spent 5+ years in a lab studying this, and you plan to continue to do so, which I really admire. If there was one thing that you wish that everybody in the world could know and really take to heart that you have learned in that 5+ years, what would you isolate? And I know that's a difficult question.
That is a
Someone,
difficult question. I think I'm even going to zoom out farther than my research question, if that's okay, because
of course.
ultimately one of the biggest lessons that I've learned during my research is kind of what I mentioned before, that there's this stigma in our society that, people with mental illness are scary, or like they're misunderstood, or they're different from us. But truly, mental illness is just kind of a condition that people have, similar to how you might have a physical illness. It does manifest in different ways, and it can be a little more complex to understand because it is more personal. But ultimately, people are not their illness, and it's important to recognize that and treat them as such. I actually had an interaction with a patient recently where I used some language that implied that I was I was congratulating them on their recovery and their remission of their symptoms, and they were saying, "Don't congratulate me, be happy for me. Like, this is always going to be part of my life, but it's not who I am." And I thought that was really powerful and really important for me, and now I'm hoping others to hear. And it's just, I think that's something I want people to understand. Like, people with mental illness, they're just people. They want human connection. They want to, be part of the community. They want to be able to live a good life. I don't think it's fair to them as a society for us to kind of alienate them and treat them kind of like these others. I think that's something that we really need to work on as a society. And it's getting better for sure, but there's still a lot of boundaries and barriers, and there's still a lot of misconception. Particularly, the media will often misrepresent people with mental illness, and it's often thought that people with conditions are violent and dangerous, but actually the statistics show that people with severe mental illness are more likely to be the victim of violence than to perpetrate violence. So it's just something that I really want people to take away from this conversation, if that's the only thing they take away, that, people are people and let's treat them like that. And yeah, I think that's one of the major things that I want to get across. The one I will say that is more related, I guess, to my research is that the brain-body connection, it exists. There's evidence to support that your mental health can affect your physical health and vice versa. And I think I want people to understand that if people are struggling with either aspect, you can't expect them to be able to function optimally if their mental health is poor, because that can affect their physical health and vice versa. So I think that's something, again, that we need to just kind of consider as a society and realize that this is something that we need to kind of try to tackle together and make sure that people are
Love that.
supported in their journey. So I think those are the two big take-home points, if that's all that
I think
people
that
take
was
away
perfectly
tonight.
said. We'll have to isolate that for a short clip to really, put the emphasis on. 'Cause I think both very well said. I mean, I have to ask you yet another very difficult question
Yes, go
to
for it.
bridge from there. Because at the capsule, one of our big focuses is how we can bring research into the development space, like the school system,
Hmm.
to enhance outcomes. And I think both points you made, we can make a case that it's most important that education on these things take place in our youth, so that we don't
Hmm.
carry this stigma into adulthood. And then secondly, in caring for our own wellness and that of those around us, we are aware of the brain body connection and how our habits might moderate this. So here's the tall task for you, the difficult question. If you had unlimited funding, unlimited public support, which, neither of these things ever seem to happen for research, so this is kind of the head in the clouds question, and you had the opportunity to reform something about the education system or even within communities to emphasize these 2 points and to raise awareness for these things at a young age, what are some important implementations that you would make based on what you know as a researcher?
Yeah, that's a great question. I mean, as a researcher, I think my aspirations for this are probably way too disproportionate to what could actually be done
Go for it.
realistically.
This is
Um,
the time to lay it all out there.
but I would love to see some kind of curriculum change to really emphasize this connection more, because right now, at least when I was in like high school, for example, we took one health class, and we talked about nutrition a little bit, but it was more about, just eat your fruits and vegetables, get your X servings of carbohydrates, X servings of protein, things like that. But it didn't really go into why this is important and how it can impact your life kind of down the road as well. Because something I do want to emphasize is that Like these metabolic problems can kind of accumulate over time, and there's a cumulative effect of poor lifestyle and poor dietary habits that can ultimately really impact you later in life. So yeah, when you're young, sure, you can maybe have the metabolism to eat more fatty foods, eat more processed foods, but there's something happening more at the cellular mechanistic level that you might not be aware of, and that's not manifesting yet, but it could later down the road. And so I'd just love to see something more in curriculums, even if it's not a full course, just taking more time to acknowledge this connection, which I think scientists, we can also do better at trying to do
Agreed,
outreach to schools and incorporate that
for
that way.
sure.
But I'd love to see that just kind of integrated so that you know that every student is getting exposed to this information or getting the opportunity to learn about it. Because as you mentioned, like it can impact just everyone in the general population as well. And it's something that people don't often think about. Typically, if you're not overtly sick or you're not diagnosed with something specific, they might not necessarily think to take care of themselves in this way and make that connection. But I think it's important for everyone that they do. And then also in terms of curriculum, I would love to see mental health talked about more. From
I'm
what I
with you.
recall, honestly, I only really learned about mental health and mental illnesses in undergrad. And that's because I had a specific course kind of related to psychology and the brain. So I think it's just something that would, again, be helpful to help reduce the stigma and just make it an easier conversation for people to have just within the community. If we start early, I think in high school, at least in the upper years, people are mature enough to handle conversations like this. And actually, children and youth are some of the most affected individuals with mental illness. A lot of illnesses start early on. And those times are the crucial moments when you want
Of
to kind
course.
of diagnose and start treating because, again, there are consequences to kind of letting these symptoms continue untreated for a long time. We do see that in the population that our lab works with, that a longer duration of untreated psychosis, for example, can actually make it harder to improve outcomes later down the road. It's really important, I think, to start these conversations early and just make sure that people are getting the support that they need in these areas and that they feel comfortable talking about it because I think that's something that our society also struggles a lot with. People still aren't feeling comfortable kind of expressing their needs in this way because there is still so much stigma and so much that's not known. And then one other thing I would love to see if it was possible is
I love the idea.
somehow getting some sort of like psychiatric professional or like psychologist attached to school. Like we have school nurses, we have kind of physicians that take care of the body, but I would love to see students have access to individuals who can help take care of their mind as well. And I think that's something that people sometimes struggle to access these resources and access these supports. So that's something I would love to see.
I love each piece of that. I'm a big believer in the idea that perception plays a major role in recovery. And you talked a lot about basically how we view these conditions, either if we ourselves are suffering from them or perhaps we know someone. And I think
Mm-hmm.
ultimately that might be the biggest rock, if you will, of early intervention is kind of shifting this perception. And I think you've given very tangible ways of doing this because this is kind of a buzzword kind of topic where it's like, we need to increase mental health support, we need to increase mental health awareness. Well, there's the blueprint. So thank you so much for not only the information on the scientific side, but on the call to action, really, because I think a
Mm-hmm.
lot of people out there really need to hear this. And as I guess, as a final question with some of the brain body stuff, because there's a lot more there that can't possibly fit into a 20 minutes of science episode. But for those people out there who are thinking, you know what, this is very interesting, and I'd like to leverage this to perhaps improve my health or maybe even its performance. Where can someone get started in terms of learning about this or just even following your own personal work as a researcher?
Yeah, that's a good question. I mean, I think there are a lot of resources out there. I read a few different books before I got into this research field. I don't remember them off the top of my head, but I can see if I can grab them to maybe put in the show notes or something. But I think there's a lot of resources that are starting to talk about this, talking about the brain and again, kind of how it impacts the body. I think that's one place to start if it's accessible to you. I also think if you have the ability to kind of peruse the literature, it can be daunting for people who don't have scientific background. But even if you're just reading kind of the abstract, which is this short summary that papers will have at the start of the article, it can kind of give you a sense of what they were looking at, how they did it, and then what they found. And it'll give you kind of bite-sized information about what's going on in the field and what's being discovered and what we're working toward.
I think that plays a major role, even in what we were talking about before with shifting the perception. To some degree, I mean, it's two-sided, right? Resources are out there. We need to take advantage of them. Secondly, us as scientists, we need to do a better job making these resources more palatable to the public and perhaps to the youth. So I think as I said before, we have our call to action. We know what we need to
Yeah,
do and
yeah,
perhaps inspire the people around us to do. Emily, thank you again for the conversation and the ingredient of knowledge you've contributed here to our capsule. And I really look forward to our next conversation.
yeah. Thank you again for having me.
Absolutely. If you enjoyed this ingredient of the capsule, we invite you to view our full formula at capslab.org. That is CAPSLAB.org. We appreciate your investment in building a healthier world.